So gonorrhea is one disease caused by Neisseria gonorrhea. So if you remember, we said Neisseria gonorrhea causes two diseases. Number one, gonorrhea, and number two, PID, pelvic inflammatory disease. So gonorrhea is probably one of the most reported bacterial infections in the US. I mean, bacterial infection affected the reproductive system. The symptoms will include urethritis. If you remember, we said in the previous slide that gonorrhea is characterized by urethritis. That's why other bacteria causing urethritis other than Neisseria gonorrhea, we call them non-gonococcal urethritis, because it's like the main cause is gonococcal urethritis. So urethritis is one of the most seen symptoms. So they attach to the epithelial cells of the urethra and they cause the inflammation of the urethra. Painful urination, and then whitish discharge from the urethra. This will be seen more in males, the discharge, as you can see here. And here we will see a picture for the bacteria. So the bacteria is Diplococci. So two spherical cells attached together, making them Diplococci. And as you can see, we have these fimbriae, which help them in the attachment. And because of these fimbriae around them, they attach to the epithelial cells strongly, and that's why they are not flushed away from the urethra. Remember, we said about the flushing activity is one of the mechanisms preventing bacterial infection. So why Neisseria gonorrhea is not flushed away, because they attach firmly to the epithelial cells, helped by these fimbriae. So they will cause inflammation, they will cause painful urination, and in addition to that, you also may see whitish discharge, especially in the males. This will be easily seen in males. So treatment will be antibiotics, but keep in mind some strains are resistant to the antibiotics, which add further problem in treating Neisseria gonorrhea. The complications of Neisseria gonorrhea include sterility. So they cause inflammation, if you remember, of the urethral epithelial cells. This strong inflammation will lead to scar formation, so like a damaged tissue, and this may obstruct the tubes that we have there in the reproductive system, so it may lead to sterility or infertility. So as you can see here, gonorrhea is a treatable condition or inflammation with antibiotics, but if left untreated, it may lead to infertility or sterility, and we can see this both in female and male. So this sterility in females will come from blocking the fallopian tubes, which connect the ovaries to the uterus, and then in males it may lead to blockage of the epididymis and vas deferens, and the net result may end up with sterility or infertility. In addition of that, it may lead to inflammation of different parts of the reproductive system, like especially in the females, like the uterine tubes, the uterus, the cervix, or the ovaries. So it will result in something like that, severe pain due to severe inflammation of the different structures in the female reproductive system. That's why it is called pelvic or inflammatory disease. So all the area of the pelvis will be inflamed, and because of that, we said Neisseria gonorrhea can cause two diseases: the gonorrhea, which includes urethritis, and pelvic inflammatory disease. It can also cause inflammation of the rectum, pharynx, meninges, and joints. So infection in all of these can also be caused by Neisseria gonorrhea. And one of the complications is that if this woman with Neisseria gonorrhea have not sought treatment, if it will give birth, there is a chance that this child or this baby will get what we call Ophthalmia Neonatra. So we have covered this before, if you remember. So it's infection affecting the eye of the patient, of the baby, I mean, and it may end up with blindness, and the baby gets this infection during the passage of the baby in the birth canal during the delivery of the baby. That's why Neisseria gonorrhea is a serious infection, especially in females, especially in pregnant females as well. The treatment for this Ophthalmia neonatrum is the historical treatment was silver nitrate eye drops. Nowadays, it has been replaced with antibiotics eye drops. So how can we take a specimen from a suspected individual and confirm that it has Neisseria gonorrhea? So as we said, it is a gram-negative Diplococci. If you go back to this slide, you will see that it is a Diplococci organism, and if you do gram stain, you will see gram-negative Diplococcus bacteria. This gram-negative Diplococcus bacteria is intracellular, so it lives inside the leukocyte, the white blood cells. So one way to do this is by taking a specimen from the urine and then doing gram stain. So you will see white blood cells, and why we see a large number of white blood cells, because of the inflammation happening there. So again, if you go back, do you remember that usually bacterial infections are accompanied by presence of pus or white blood cells in the urine? So because of that, you will see these white blood cells. And if you pay closer attention, so in addition to the nuclei of the white blood cells, you may find the Diplococci Neisseria gonorrhea hiding inside the white blood cells. So let's zoom it more. So we'll have Neisseria gonorrhea, Diplococci, as you can see. So this is one cell, this is another cell. So Diplococcus bacteria inside the white blood cells. So this gives you indication that this is Neisseria gonorrhea, because it's an intracellular bacteria. It is fastidious, so it needs special requirements in their growth, and one of these requirements is that it is capnophilic bacteria, so it needs more carbon dioxide. That's why in the labs growing Neisseria gonorrhea, they don't grow it in normal incubators. They have what we call carbon dioxide incubator, because this bacteria is capnophilic. They survive poorly outside of the body. They need special transport media. We call this media Thayer-Martin agar. So it's a type of chocolate agar. And what is chocolate agar? Chocolate agar is actually a blood agar that has been heated to high temperatures. That's why the blood, the reddish color of the blood now has been turned into brownish color. So in addition of this chocolate agar, we add some antibiotics that are inhibitory for other bacteria, and they allow the growth of Neisseria gonorrhea. That's why we call it Thayer-Martin agar, and that's why it is an selective media. It is a selective media because of the presence of these antibiotics. Neisseria gonorrhea is an oxidase positive organism, so if you do the test for oxidase, it will be positive. It can ferment glucose, but not maltose or sucrose. So it will turn the color of a test tube containing glucose into yellow due to acid production, but negative result with maltose or sucrose. So all these could be a confirmatory test to confirm the presence of Neisseria gonorrhea in the specimen. Moving on, so in addition of bacterial infections of the reproductive system, we have some viral infections as well. We have already covered the genital herpes, which are caused by herpes simplex virus type 2. If you remember, type 2 is the one that affects the lower half of the body, the lower part of the body. Type 1 affects the upper half, and this has been discussed before. We have also what we call genital warts. These are caused by papilloma viruses, and we have AIDS, and also we have discussed this before. There are also fungal diseases that may affect the reproductive system, and here we will take an example is the Candidiasis. We have already covered the Candidiasis before, but we cover the Candidiasis in terms of oral thrush. So it is similar to the thrush lesions that we see in the oral cavity, but now it is happening in the reproductive cavity, especially in the females, as we said, because of the acidity of the vagina. So in the female, Candida albicans may be present, and it will result in this thrush. It will result in severe itching. It will result in a yellowish or cheesy discharge. So what are the predisposing factors? Number one is antibiotics, and especially broad spectrum antibiotics, as you know, because they remove the normal microbiota that lives in the vagina, the lactobacillus. And also they are affected by hormonal estrogen levels, so things like pregnancy, contraceptive pills, and also diabetes. All these factors are predisposing factor for Candidiasis. So Candida albicans is an opportunistic type of yeast waiting for the right opportunity. This opportunity may come after using a broad spectrum antibiotic, or may come after an increase in the estrogen levels, or may come from a disease that decreases the immunity, like diabetes. So we have seen the symptoms. What could be the diagnostic test? The diagnostic test is wet mount. So they take a specimen from the vaginal discharge, and they mount the bacteria there, or the fungal there actually. They mount the microorganism there in aqueous solution, so it's a wet mount, and then they examine the culture. What are the treatment options? As you know, it will be antifungal drugs, for example, the miconazole or clotrimazole. So these are different antifungal drugs for treatment of Candidiasis. So here is a slide summarizing that we can take specimen from the vaginal discharge. We will do it in a wet mount, and we will examine if we see this hyphae structure. If you remember, the yeast can exist in both the mold structure and the yeast structure. If you remember, we have something called dimorphism, so they exist in both forms depending on the temperature. So if you take this specimen and incubate it at 25 or incubate it at 37 degrees, and you see different morphologies, so that will confirm the presence of yeast. So if you can see the thread-like hyphae structure, and you can see the yeast-like structure, which is more spherical and with budding. Some cells make these buds. So you can also grow it in certain media and see the characteristic type of growth of the yeast, or do a gram stain and see the yeast, again the same appearance, so oval cells that are gram positive. So all of these are confirmatory tests for the presence of Candidiasis. So here is a summary for the learning objective of this lecture. Hopefully it was helpful, and wishing you all the best. Thank you so much.